of EPIC's Air Quality Life Index program, designed to spotlight concrete examples of how air quality data is being used around the world to drive meaningful change. Our aim is to learn directly from the leaders who are turning numbers and data into action and to cleaner air and ultimately longer lives. Um, and uh, And speaking of cleaner air and longer lives, the AQI's latest update to measure how much longer we could live if our air were cleaner came out just last week. It shows that reducing fine particulate air pollution could add almost 2 years to people's lives globally. We've also revamped our website to provide more data customized to where you are across the world, and you can access those both here at this link, and I believe also a link that'll be shared in the chat box. The report also highlighted a finding from OpenAQ that 5.5 billion people across the world live in countries without access to a minimally recommended amount of air quality monitoring. And this is especially true in the African context, where, at least as of this 2021 analysis, no country met the minimum threshold. Um, and I believe that this lack of data across the world and in Africa is symptomatic of a larger issue, a lack of investment in air pollution, especially relative to the harm it causes. So you'll see this figure here, which shows the philanthropic investment in Africa per life year lost from life expectancy in US dollars in millions of US dollars per year. And so you see for HIV AIDS, $985 million are invested per life year lost on the continent. For malaria, 908 million. Yet for air pollution, it's just $186,000 per life year lost. That's about 5,000 times less than those other two issues. And so to respond to this larger investment problem, we launched the EPIC Air Quality Fund in 2024. We identified countries that showed especially high opportunity for a modest investment in air quality data infrastructure or air quality management in particular. And you can see these in this image where there's the dark or light purple colors. And we've so far been able to invest in 31 groups in 19 countries. And one of the awardees from our very first round, before we'd actually even officially launched, was the nonprofit Permian Health, that they focus on improving lung health in the Gambia and beyond. So I'm especially honored to host this session today. I'm going to stop sharing my screen here. Because it highlights the remarkable progress being made in the Gambia over the past few years, not just by Permian Health, but also the Gambia's National Environment Agency, which closely partner together. So we're fortunate to have with us two of the central figures driving this work in the Gambia, Dr. Dawda Badgie. Dr. Badgie is an environmental scientist and policy leader and is the executive director of Gambia's National Environment Agency. The NEA is the advisory body to the National Management Council in Gambia, which the president of the country chairs. And Dr. Sunkaru Touray, he's a pulmonologist and founder of Permian Health. Permian Health, as I mentioned, is a nonprofit that promotes lung health in the Gambia and beyond. And one of those ways is in engaging in air pollution issues in the Gambia. So together, the NEA and Permian Health have built a partnership that not only measures air quality for the first time at a national scale in the country, but it also connects that data to health and policy and public action. And you'll get to hear about all this in the next hour or so. As our conversation unfolds, I'll ask all of you in the audience to submit any questions you may have using the Q&A feature, and we'll get to some of those toward the end of our conversation. So with that, I want to thank Dr. Badgie and Dr. Touray again for joining us. And I'd like to start off by talking a little bit about their journeys into air quality work. And Dr. Badgie, I'd love to start with you in particular. And hear a little bit about first off, the NEA's mission and its mandate around environmental issues, including air quality.
Thank you very much, Christina. Thank you so much for that elaborate introduction. And then it's a pleasure also to be part of this very important session with other stakeholders around the world, and then also your university for hosting this important garden. Yes, as you rightly said, the National Environment Agency is mandated by law to manage all environmental issues across the country. It is an act of parliament that established the agency over 30 years ago by the First Republic, and basically our mandate cut across all the three medium of the environment: air, land, and water. So, and then we work towards ensuring that those three mediums are conducive for human. And from your presentation, I've seen a very startling statistic. And when you talk about the issues related to malaria and other diseases, and you look at the air aspect, it's virtually, there's not much work globally, particularly in Africa, when it comes to issues related to. And I always say in most of the food, I said it because air is free. So people don't take into about it because it's a gift of nature by God. So people don't take it seriously as if, and most of the issues that are related to very serious diseases are actually can come from there. So in a sense, this is something that also as a country, we actually have some legislation towards that one since 1999 dealing with issues related to air quality and but not actually very serious issues were done over the past years in addressing. Some time back, we had some air quality monitoring, but they were damaged, in 2000 during one of our student riots. And since then, the agency and the necessary stakeholders could not do much in addressing those issues. So there about 2023, we had this engagement with Permian Health Institute. And this is a very important collaboration where we were able to have installation of a lot of air quality sensors across the country. And then we are proud to say that we have installed almost 20 or more air qualities across the country, and that actually entire country. And, data is very important when you are trying to change the minds of policymakers. And at some point, when we first published one of our data over 1 year, I presented that one. The National Environment is managed by a council, the National Environment Management Council, which actually the president serves as the chair and the vice president serves as the vice chair. And that council, the members of the council constitute 10 ministers. 10 ministers dealing with, so it's a mini cabinet. And the agency serves as the secretary and also serves as an advisor to both the president and the council on environmental issues when they are directing issues related to policy aspect and so forth. So this become a when they saw those results, they were very, this is what is happening. I say, yes, this is what is happening. And then there's a need for us to do something to ensure that people are aware. And then that includes the Minister of Health, the Minister of Environment, the Minister of Energy, almost all, the Minister of Finance, and actually become a very broad. So when they saw those information, they were very much, and each of them were given information, and they were very interested to read those things and then realize that this is what is happening in the country. And some of the issues that, particularly in certain areas, those are things that are basic that people are doing that is affecting them. So this is something that really create an eye-opener for us. And currently, and in fact, we have also worked on legislation that is now strengthening issues related to air quality. And also those legislations are easily even they're almost currently at the third reading at the National Assembly. So hopefully they are on recess, but hopefully when they start before the turn of year, that legislation will be, and the president actually is ready. We said whenever they are done, I'm ready to endorse my whatever is. So at least we have that sense of direction from policy level based on the data that is shown, because before we don't have this. And that was, if you want to talk about something, if you cannot see evidence, particularly politicians, I always say something which is also, I said everybody want to go to heaven, but nobody want to die. But if you know what is going to kill you, you always try, what can lead to your death. You always have to be careful. So when you give this information to politicians, they become, oh, particularly the policymaker at that level, political level, they realize, this is something that we need to work on, or this is very, very important, we need to work on it. So essentially, this is some of the things that that we are going. And then we also have the coverage tower level, because we have in very sensitive areas, particularly where a lot of activities of, like the airport, we have the Gambia Port Authority, the stadium, certain sensitive areas, the fish landing, fish smoking sites, particularly within the urban, peri-urban areas, we have a lot of installation. And then also in some growth centers across the country, up to the far part of the country, like this, the URR, which is the last. So, and then they are also our team. We have a very delegated team with Permian Group. We normally go to visit those to see their conditions, make some necessary monitoring what they are doing here and there. So at least, in fact, not long ago, they were all along in the field. They came up with a report of almost all the, you can see the report that was sent for almost seeing the condition, see what is happening around that end. So this is something that that we are working on, but still, to really have a very good universal coverage, we need more of this where possible. And also we realize that there's a lot of health implication, some of the things that we are doing from this air quality. And in the Gambia, the air quality has almost 3 different scenarios. There are a particular area where you have what you call the peak period of where you have a lot of pollution, particularly during the dry season. And that is actually influenced by so many factors, because during the dry, a lot of dust, a lot of activities going on. And you also have another, what we call a transitional period, where maybe doctor will actually, during the presentation, will show those scenarios. And then you have also a transitional period where the dry season is basically January towards March. That is a very dry, and you have a lot of dust coming up, particularly in the Hamatan or whatever, that also have some influence in our country. And there, the quality of the air is totally not conducive. And also you have during the transitional period of April to June, which is also there, is not as much as good, but better than January, March. And you have what you call a period which you consider as a very comfortable period, that's the period we are in, which is July, August, or September. End of September, we have rain, and now we don't have much of those problems. But in addition to that, we have other areas which are called hotspot area. You will see it in the presentation, where they are doing a lot of fish smoking, and also sometimes areas related to certain municipal dump sites where there are a lot of uncontrolled burning. Even we're doing a lot to ensure that this unnecessary burning of waste and so forth is controlled. And we're doing a lot of effort to monitor those things regularly to ensure, and that has reduced drastically now because of our interventions and so forth. So we have a lot of things that we are doing, both from the policy perspective and also in terms of burning, open burning is also, in fact, that's a no-go area. And also strengthening and the transport system, that we are even working with the Ministry of and the police, because you have an MOU with them, so that some of the the emission vehicles that are really polluting are stopped straight away when they are applying on the road. Because we once had a report trying to see the effect of those emissions from the vehicles, which is very, very interesting. So we work with the police, and also we involve, because we realize that most of the impurities are actually trapped by trees. And we came up, in fact, currently I'm working with the Office of the President and the Minister of Toko, what we call Gambia Go Green Initiative. This is something that we're working on, and then to ensure that we have at least change our barren areas into green, so that will be able to capture most of these air pollutants and suspend them rather than. So that is an initiative that we have started. We call it Triple GI, Gambia Go Green Initiative, which we are. I'm working with hopefully next time you come to Gambia, you'll see a different face, particularly in our urban areas. So we also have that collaboration. We also look into other collaboration because at least what we have, we realize that it's not much in many of the regional countries. So we see how we can collaborate with our neighbors, Senegal, Mali, and other ECOWAS countries. How can we work together to fight this problem of air quality? Because it's a problem. And the only way you can really raise the problem is providing information, data that you can present and people recognize this situation in those aspects. So these are some of the things that we are looking into, and then we are collaborating greatly with some of those, particularly some of the environment protection agencies in Senegal and so forth. And then we also have to look at it to leverage where we can get support. It's not always easy, but we'll also welcome any international support where we can get through clean air funds where possible to support our initiative. We are not standing by, but I always say to people that, if you are on the road, that's likely that somebody will find you there and help you to move forward to your destination. But if you are sleeping in your house, thinking that you want to go to a place and you are not on the road, that's likely that you'll be there for long because nobody's going to. But if you're on the road, somebody may find you, whether it's going to be a bicycle or a tricycle or a car. Somebody may find you sitting there or walking and say, "Oh, where are you going? Can I give you a ride to this place?" Then we are moving. But if you are sitting somewhere and say, "Oh, I want to go to the next village, but I don't know who's going to take me there." If you don't start walking, God is going to find you on the road. So this is why we felt it is also important. We have to start a process. And then that process is going to at least also see other people to find us on something that is, and then the government also is ready for that because they have now seen the importance of what we are doing. And that document is something that has really changed. And I can remember the finance minister, this is very interesting. They don't want to give out money, particularly, but I told them now, this is what is happening. And the health minister will say, I think now finance, you have to look into how can you support this initiative. So we are not funded by them directly now as a government institution because we are as a subvention, we are not there, but we can come up with certain things that we can also leverage on certain funding mechanisms and they can support those initiatives. So in a sense, these are some of the things that I want to share. Frankly, the Gambia, the issue of air quality is a concern. And then we also create a lot of awareness. We even want to embark, my team even came up with a concept note where they want to go around the country, which we want to look into so that they can actually bring awareness creation on some of the things that we do at household level. Because, here also we have there are certain essence that is born inside, that is indoor pollution. But people don't know, they think that they are creating something, a very good odor in the house in the process. They are really polluting the entire family and they don't know the implication of that. So those are some of the things that we do it during in our most of this conference we normally have, the air quality content that we have with Permian Health. And then those awareness are created, but we want to go to the grassroots level to educate people on those things as well. So these are some of the things that, like my house, I told them that I don't need anything of that nature because you don't know what you are doing. Because if you do it, you are killing yourself systematically, and then you don't know what you are doing. So at least I said I don't want to see these things, so don't bring it to the house. So at least that awareness has, because I never knew about those things, but now it has really led me to know those kind of things as well. So in a sense, we also want to get how we can get some more monitors, particularly the BAM, so that because currently we have a BAM that is actually hosted placed at the National Environment Agency, which is a reference monitor. But we also want to see how we can improve other areas, particularly at regional level. But this is something that we are working towards. We find other means how we can get it, but wherever we can get those
Now,
low-cost sensors will be a good thing. So in short, this is what I wanted to share, but hopefully, Mr. Doctor, and I know if these things are done, that's likely that it's going to reduce a lot of premature deaths and protect the vulnerable groups, particularly women who are involved in a lot of fish smoking. We also want to see how we can improve their smoking mechanism. This is something that we want to look into. Yesterday, I was having a meeting with UNIDO, and one of the things that we discussed about the cold chain aspect. We talked about issues related, how can we come up with a project that's going to improve the fishing areas, particularly those who are involved in the smoking. That area, when you pass there, you are even in a haste to pass quickly. And look at what the people who are in that kind of a condition for the past how many years. So, and I always tell them, sometimes we blame God too much. For us, when you die, oh, God, God. I say sometimes we blame God too much for some of the things that can easily be prevented. So on that note, this is what I wanted to share. And then hopefully, as we discuss, maybe we reach that level, we're able to set light on some of the things that we are doing. But I'm very much grateful to be part of this kind of conversation on how can we make the world better, particularly addressing issues related to air quality that we just feel it is something that is just cheap because only is a gift of nature. And then let me share something. There was a time we involved the religious leaders, both all the faith, on a discussion. And one time, one of the religious leaders gave a small thing. He said that one of his relatives went to the hospital and they put him on oxygen. And then after when he got recovered, they gave him a bill. And they said, but the man started crying. And I said, why are you crying? The doctor said, but now you are well. Why are you crying? The man said, okay, now when I came, the past how many years, over 50 or so years, I've been having air from God free. And today I'm here for this number of days. And then you ask me to pay something that I was given. Then it is important for us to hold this thing that God has given us with seriousness, because at the end of the day, all the air that I've breathed over the past 50 years at no cost. Today I'm here, the oxygen you have given me. Now, if we pollute what God have given us, how many of us can sustain being given oxygen in the hospital? So this was something that came from our engagement with the religious leaders. And that's the time they realized that, oh, then we have to do something, educate people, whether in church or in our mosque, so that they have to be very careful in what they do outside to protect the air and make sure that air is conducive for everybody's survival. This, on conclusion, that's what I wanted to share with you. Thank you so much for the opportunity. Yeah.
Thank
Thank
you
you.
so much. Thank you so much, Dr.
Yeah.
Badgie. That was fantastic. And you mentioned you got to be on the road in order to get somewhere. And I don't know. I think you all might be in a Ferrari going pretty fast down the road with all the activities you all are doing and have underway. And one of the things you mentioned that of course comes to all of our minds with air pollution ends up being the health implication. And so I think that brings us to Permian Health and to Dr. Touray. And so Sunkaru, I'll ask you, you're a medical doctor, you're a pulmonologist. How does a pulmonologist get involved with air quality monitoring per se? What was a little bit of your path to get to do this work?
well, thank you for the introduction. And Dr. Badgie, thank you for that introduction as well. I got involved in air pollution by accident. I finished my training in Massachusetts and started seeing patients in Gambia. And I was expecting to see, the usual older patients, smoker with COPD or asthma patients. But then I was struck by a lot of patients that I was seeing who were very young, and especially women who'd never smoked in their life, that had very severe, respiratory symptoms. And, at the time I was doing lung function testing, they had very diseased lungs. I mean, the we had people in their 20s, in their 30s with lung function of a 60, 70-year-old person who smoked. And that didn't make sense to me. And I'm like, something must be driving this. And it wasn't TB. We usually think about that in Gambia. And, you are what you breathe. And so I thought, okay, what is it that people are exposed to that's causing them to have such diseased lungs at a very young age? In the United States, if you tell me your address, I can pull up the air quality in your neighborhood. And so I thought, well, somebody must do some work on air quality in Gambia to see what the air quality is like in the country. This was about 7 years ago, 6, 7 years ago now. And at that time, there was no information on air pollution. It was just no data. And so I thought, okay, we need to start looking into this. There was some research being done by the Medical Research Council at the time. And so I said, okay, it was a nagging clinical question, basically it is. And so after COVID was a bit of a distraction. So after we recovered from COVID, I decided to start installing low-cost sensors in the country. And I started off with 4 sensors. And then I started getting these readings. I'm like, wow, this is actually quite serious. And what started off as a clinical question turned out to be a drive to scale access to monitoring. And so I very quickly realized that the solutions to the problems that I had in my practice was not going to be solved by me at the bedside. And so I quickly got in touch with the agency, and that's what started this whole initiative to build a network for air quality monitoring.
Thanks for that. And I think that's actually the perfect segue. So you described how you started engaging with NEA. I think it is the perfect segue into a presentation you have that'll tell us a little bit more about both Permian Health and NEA's work. So I'll turn it over to you for your presentation, and let me make sure you're able to share, and then I'll set you off. Looks good from here. Oh, you're muted.
Yeah, so this work is a collaboration between Permian Health and the National Environment Agency. So, like I said, when I figured out that we need to do something about this, I looked at the stakeholders within Gambia and found out that the agency was the legally mandated authority on this issue, and we've been in partnership with them and the Ministry of Health for the past 3 years now. We obviously can't go installing sensors around the country without any permission, so I had to get them involved for one of that. So it's just one of those tips that I would recommend people who are interested in doing this work very quickly partner with the local regulatory agencies to do that. And we started off with 4 sensors, and then very quickly we scaled that up. Now we're currently at 27 sensors across the country. We also got a reference monitor that we've installed at the National Environment Agency, as Dr. Badgie indicated. And I'm just going to go straight to the data because so this is kind of where we started out from. 2022, no data. 2023, first sensor, and we had our first Clean Air Conference in 2023. And why we did that was because we wanted to get all the stakeholders involved very early on to let them know that we were going to be scaling up monitoring and that we had the intention to make this data available to drive policy change. We were fortunate enough to get the EPIC Award in 2024 that then allowed us to then really scale nationally and install the BAM. And then in November of last year, we put our first BAM at the National Environment Agency. And, this is kind of what we've done over the past few years, just collected data from these areas, and we've been analyzing that data now. And for the first time, we have this kind of data, which is quite shocking, that the 24-hour mean PM2.5 for Gambia is about 98 micrograms per cubic meter, which is really high. And if you think about the fact that the WHO recommends a daily exposure rate of about 15 micrograms per cubic meter, this is considerably higher than we've had. And we've seen that all across our network. These are sensors that are installed in urban areas. And you can see, as Dr. Badgie indicated, that in the dry season between January and April, we have a very high, desert dust storm called a Hamatan that blows down into the Gambia. PM2.5 concentrations in those months, are typically in the high 90s, sometimes as far as the 100s to the 400s. And a lot of people have bronchitis. They have a lot of asthma exacerbations, that kind of stuff that time of the year. And we see the same in rural areas, but there's a bit of a difference. Rural areas actually have poor air quality compared to urban areas. Brikama and Soma are rural areas on the inland part of the country, where Kanifing Industrial Estate and Bigelow are on the coast. And you can see that the baseline levels that we are getting in these areas are considerably higher than in the coastal urban areas. But we can see in both graphs, there's that downtrend that we see with the rainy season. When the rains come, we have much better air quality in these areas. Now, this is the kind of information that you would not be able to collect if we didn't have a low-cost sensor network. BAMs are expensive. You can't put BAMs everywhere. And I would say also that although BAMs are good for reference data collection, they're more accurate and obviously more reliable as far as policy making. But what low-cost sensors do is that they give you a general idea of the trend. And we've seen a good correlation between the trends that we're collecting from our low-cost sensors and the BAM. We are in the process of calibrating the data from the reference monitor with the low-cost sensors, and we'll be applying the correlation coefficient across the network with our partner IQ Air. And then obviously I talked about rural, urban, inland divides, but even within the same town, again, this I thought to be very fascinating. Gunjur is a town in the southern part of Gambia, and we have two sensors in Gunjur. One is located in Taft City, and Christa, we've been there. It's a high-end, master planned urban community with green spaces, paved roads. And then Batosate is a fishing village that is on the coastline, and you can see from this drone a lot of fishing activity going on there. And we've seen that people that live in Taft City, the average, PM 2.5 concentrations in the Hamilton dust season is considerably lower than, in the Barasate. And also the peaks in the dry season are much higher in the fishing village than in Taft City. And in the rainy season, when the air quality is better in both places, Taft City was able to meet the WHO daily limit, below daily limit for the WHO PM 2.5 concentration. So this is a classic example of, how where you live has an impact on the kind of air that you breathe, and undoubtedly have an impact on, the health and well-being of individuals in these two different communities that are just 5 miles apart. And so, again, this is the kind of data that having low-cost sensors can give you that you would not be able to get with the BAM. And so, with that, I wanted to also talk about some of the work that Dr. Badgie has talked about. We've been able to use this data to write annual reports. We have two legislation in Parliament that are currently making their way there that were tabled by the Minister of Environment, the National Environment Management Act, that will give the agency the legal framework to establish ambient air quality standards, and the Road Transport Bill, which is an upgrade to our Motor Vehicle Act of 1948. You think about that. The last time this was done was before we were a country. So this kind of data has the ability to make us reflect on things at a very national level. And I'm also very excited about this because now, due to our partnership with IQ Air and the API platform, QTV is now going to be rolling out the use of the API, not just for the weather, but also for air quality information in local news as part of the local news network. So, multiple people are using this, and I think in the coming year, we're going to have, especially when the Harmattan dust season comes in, people being given, health advisories as part of the news in the local languages. So I'm just going to stop here and see if you have any questions, any concerns, and happy to chime in from there.
Thanks for that. That was all super cool. Very cool news about QTV, I have to say. And reminder to the audience, and we're already getting a few questions put in the Q&A box, but feel free to put in some questions. I've got a few questions for both of you as we're going, which I'll ask first. And the first one's to you, Dr. Touray. It's sort of a meta question, backing out from the data itself. You've talked a little bit about previously, I've heard you talk about data sovereignty and how as I understand it, it's a core tenet of the air quality work that you're both leading. And I wondered if you could talk a little bit about that term, why you think it's important in the Gambian context, and if there's anything you could say in a broader context of why data sovereignty matters for your work or clean air work at large.
Yeah, I think for us, data sovereignty refers to the concept where data that's generated within a certain jurisdiction or by an individual or an entity is accessible and usable by those individuals who generate the data for the purpose for which that data was being collected. It also has a broader concept where, a legal concept, where data that's generated within a certain jurisdiction should be accessible to any interested governmental agency that has an interest in that data. Many African countries, and especially Gambia, does not have any data sovereignty legislation. So when we set out to do this initially, we were very deliberate because we wanted to have access to that information. And also, we had a very big part of our mission being data transparency to ensure that the data we generate is accessible to anyone that has an interest with that. And I was very honest, I mean, very complimentary to our partner, IQ Air. We have a signed legal agreement with them, and they give us full permission to use the data in any way that we see fit, which I think is a very important thing that anyone considering this kind of work should consider. Recently, we've seen in some countries that had ongoing reference monitoring at U.S. embassies lose access to that data due to foreign policy changes in the United States. Those countries that don't have data sovereignty legislation cannot access that data. But the United States has a Cloud Act that means that in the United States, any data that you collect, even if it's stored outside the United States government has the authority to access that data. And I think it's a clarion call for countries around the world, and especially in Africa, to start thinking about putting in place these legislations. And we are going to definitely talk to our government about ensuring that we have that legislation, in place to ensure that we can access that information for our own national endeavors. So we are a government entity. We are partnering with the government. We own the hardware. We own the software. The software belongs to our partners, but we have the agreements with them to ensure that we use the data and we can access the data and use it for very impactful work that we're doing in the country.
Thanks for that. I think sometimes these data ownership type nuances sound weedsy, but as you sort of articulated, it actually matters a lot for what a country or community can do with their data. Dr. Badgie, over to you. A question around often people talk about data affecting policy very broadly, but you're actually doing that with this landmark legislation that's underway. I guess if you could break down for the audience, who I think would be very interested to hear, how do you see the role of the data that was collected by the NEA and Permian Health together? How has that influenced this landmark legislation? How did it help it come to be? What's sort of the role of data, or even the relationships around the data, to that stage where you're at now with this landmark legislation on the cusp of happening?
Yeah, okay. Thank you very much. I think that's a very brilliant question. In real life, the issue of data is very critical in at least changing people's mindset. If you don't really show facts, and the facts can only come from data. If you don't really show facts, people don't actually take what you are saying seriously. And particularly when you are dealing with ministers who don't have time, ministers who want to see how things, when you are briefing them, you have to come with facts, and the facts can only come from proper data. And before, when you talk about problem issues related to data, people don't understand. And even also when we go for monitoring, because we don't have the necessary equipment to back certain pollution that is happening in a particular area. When you talk about people, how do you know that this is what is happening there? So this issue of having this data has really supported us in trying to pass those messages. So what I did when I put this thing in one of our council meetings, I decided to go with this information. And then I shared almost every member, every council. The first one I did was to give the president those documents. And then I know it will be difficult for him to read or whatever in terms of having time to look at those things. But at least he's aware of this thing, and I show him some of the area summary of what he can look into to see. There are certain things that you can easily grasp quickly. Then the other thing I decided when I was going to the meeting to meet the minister in our council meeting. I decided to go with those information. And those information are very, very key for them to realize that, oh, in our country, this is what is happening. And I think for them also, most of those ministers, particularly those who are manning some of very key sector, they are highly educated. They know the issues. So when they read these things, it will become very interesting. Even those who are not very much like the finance minister, it's a finance guy, it's a finance person. But when you look at this information, you say, oh, is this what is happening here? I say, yes. And you know what? This one don't know any politician. It doesn't know whether you are a politician, you are a minister, you are what. When the air pollute, because you have to breathe it. So when it is polluted, it's everybody's concern. So what can we do as a country to ensure that? So that's why when this legislation went, it did not. In fact, I think the delay is from when the legislation. And when you prepare a legislation, you have to go to what you call cabinet approval. But this is one of the legislation that went to the cabinet. The cabinet, it was actually even supported unanimously per se, because of what, and then it talks about other environmental issues, but the issue of air quality is something that but we already had a law which is related to air quality, but not very, which is related to air quality, but some sections of there. But now we are even looking in the future to have a regulation that is going to be focused on issues related to air quality. So the data has really, and data is what they call, the data don't lie, figures don't lie, particularly if you're able to get the necessary instrument to back up what you are arguing. And this is what we have done, and it has really contributed positively towards changing people's. So at policy level, the acceptance is there. And there was a time when the minister, when I did my presentation, the minister also mentioned something to her colleagues. Say, you know what? Before, I was never taught that this is what is happening in Gambia. But when I participated in one of the conferences and this data, then I realized that, I'm even doing things that are even impacting on my health that I don't know. So it was become a game changer because he participated in most of these things and saw figures that you cannot deny. And he said that it's very important that we have to take some stance to address issues related to that. So it has really helped us a lot. And I know, hopefully, the next thing, if you look at maybe 2 years or whatever, that will be able to convince them that, we need to take action, even though the action is being taken, but we need to take very much formidable action to ensure that. And when I also saw that, you have also all this monitored all over the country, I say, yes, we have, even though we don't have them the way we want it, but at least it's also a game changer in time to know that in any major place of the country, these facilities are there to monitor what is happening there. And these are things that it's not like it is actually automatic, so it's not like it is influenced by any other thing. So it's something that has helped. Data is very key, and data help to take informed decisions. No data, it will be difficult for you to convince people, because people have to see what is happening for them to be convinced. No supporting information, it is very difficult, because you'll be talking from a very abstract kind of situation, and people don't rely on those abstract kind of situation. But data has really helped us a lot as an institution. And then our collaboration with Permian Health Institute has really changed a lot. And then we are hoping to have more positive change in the country as we move along.
I think it's really helpful hearing your perspective as someone at the senior level in an environment agency describing.
And then, in fact, our agency also, our role also is to come up with. So, for example, if you look at other areas that our role is to advise what kind of policy directions. So we also have some, because the agency run into different aspects of, because we have a lot of, we have 11 programs dealing with different aspects of the environment. And in any situation where we see this, that's our institution to give them information, because we normally have what you call a state of the environment report. That is normally given almost every 5 years, that inform our state of environment in the country. So the last one was even 2024. So that is also a policy document that is actually signed by the president and the minister. to ensure and then we tell the state of the environment report where we are now, what are some of the situations going on, and what are the future things if we don't take this thing. And we see the projection. If we don't take these decisions, or if you don't take these measures, this is what is going to happen. So this is something that also guide us in terms of, and that also have to be backed by data. If you don't tell them what is happening, what we are there before, what is happening now, and what is going to happen in the future if these measures are not taken. So it becomes a document that is almost every 5 years we normally give out that one. So it's a policy guide, and that also inform what we need to do next to address most of this situation. And then we even have the police. Because of those kind of monitoring aspects, we even have a police unit within our to ensure that we do monitoring effectively. And then that the Inspector General of Police we've already created a police unit, and then we are here with them to ensure that those monitoring at all level is done accordingly. And we go with them for monitoring purposes as well. So this is as a result of what they see and what we propose to make sure to address this issue. This is what we need to do moving forward. Yes.
And you had mentioned in your introductory remarks about, looking forward, and you touched on it here too. Would you talk us through what you see next for the NEA, really beyond the data collection? There's now this, landmark policy that's coming in, hopefully in place. And so what sort of activities do you see next in the pipeline, policy type activities do you see next for the NEA for air pollution, and what kind of support are you looking for to make these things happen, or barriers you see alternatively? But would love to hear what you're thinking of next steps for the NEA.
Yeah, so for some of the things that we intend to do, basically, what you call short, medium, and long term. And we can categorize into that. Some of the short aspect that we need to do is to create awareness. That is very, very important, based on the information that we have received, based on the data that we have. So that awareness is there to really reach out to people, to tell them this is what we are doing, this is what is happening, this is what we can do to avoid, or this is what we can do to limit that one. So that is very, very key when you come to allowing people to be aware of what is happening, some of the action that they are doing that has some implication with respect to the air quality. And the other thing that we intend to do is actually to look into a possibility of upgrading or trying to improve our monitoring mechanism, particularly having the necessary equipment. And even when we are going in terms of monitoring, because we do that frequently, those handheld kind of monitoring equipment that when you go to assess a particular area, you can actually be able to give a basic aspect of what is happening there within that facility, right? It's a factory or whatever. And the other aspect that is collaboration, which you also have, I particularly mentioned about that vehicle something track, to make sure that we are working with the transport ministry to set up, they're actually leading the process to set up some of this situation where they're going to monitor most of these vehicles before this emissions control kind of mechanism, but they need to have a facility where vehicles have to be tested, and then we give in a certificate kind of, so that every period, either every 6 months or so, you have to regularize your status in terms of your emissions, so that you will not be a polluting vehicle. And any vehicle that don't get that tag will not be allowed to ply on the road. And that also cut across. And I told the minister that if you want to do that, you have to start from government, because most of the government vehicles are the biggest polluters on the road. So if you're going to make that mechanism, it's not going to be a mechanism that is going to target only the commercial vehicle. We have to start from ourselves, so that every vehicle have to have the roadworthy before it plies on the road. So these are some of the things that we are working on with the Minister of but the other aspect also, we are also collaborating with currently in UNEP send me. We are also trying to work on with the United Nations Environment Program, because they have this air. In fact, I think on the 7th, is going to be international. They send me I think on the 7th or 9th, any of this, they send me some information. What are we doing at country level? They want us to share those kind of information at national level, what we are doing, and see how we can collaborate. I already actually identified some staff that are already going to be focal point for that. And then we are also working toward at national, international level with the other donor partners to see what can we come up to address. So as I said, now we have a baseline per se. Now we can also say at Gambia level, this is what we are working on. So it becomes very easy to come up with something that can help to improve what we are doing moving forward. So in a sense, those are some of the areas that, but at least for able to have a very thorough coverage, we really need some of these additional sensors. Other things can come in as I said, medium, long, other projects can come in that is going to improve a lot, particularly our provincial areas. But the sub aspect is awareness. The other thing is already collaboration that we are working on. But government takes a long time. But if we also get something that can help us, even with UNEP, to help to set up those kind of things, empowering even a private sector to come to set up those centers for servicing of some of these vehicles to ensure that they are satisfied. I can remember sometime I went on a training in Singapore, and I went to that vehicle testing facility, and then almost every vehicle must have a disc. Every 6 months, they have to go and change that disc so that at least they are not polluting whenever they apply. The laws are there, but as I said, most of the violators of the law are government. It's actually the central government. So when we come, we have to make sure that that is addressed. But now they are aware of what is happening because the Minister of Transport and Infrastructure is part of the council. So, and in that council, we also mentioned that, most of the problem also is associated with the transport sector. So they are also aware of what is happening, and he's very much keen about this thing as well. He said, "Oh, I never knew about this thing." So, but thank God they are now aware, and that has really changed positively towards whatever we are doing, and they are ready to support the agency in that, and that has also given us a leverage when I'm looking for other additional support as well. Yeah. But in reality, this is what the roadmap we want to work on, and then ensure that we get those aspects. And also capacity building in terms of some of the personnel that are also going on. Because at some point we train some, but people come and go. But now I try to engage young, dynamic people before they think about moving. They will have contributed positively. But we train some people, but they left. But that's part of life. But now we also come up with very young and dynamic people that we are working with at agency level that are almost involved in most of the activity that is happening across the country. And they are very agitated to achieve something.
Thanks for sharing that roadmap. And speaking of dynamic people, I will switch to somewhat reluctantly. I'm going to switch to other questions coming in, not for me because we have some good ones coming in, and just a few minutes left. But we have a good one coming in for really both of you, from Collins Hodoli, who's also actually a fellow Epic AQ awardee, and he's asking. I'll ask you first, Dr. Badgie. He's asking, he's in Malawi, and he's working to engage the government there. Would you have any recommendations for, let's say, a nonprofit type group that wants to engage with their government on air quality? Would you have any recommendations for a group that how they can best go about that? What made the relationship between Permian Health and you all so strong, for example?
Well, actually, as Dr. Sunkaru mentioned, he was coming here, and then while he was doing, and then he realized something, and I think and I think I found him to be very, very proactive, particularly the Permian Health Long Institute. I found him to be very proactive because the moment we click, it took just a few times because we all realized the situation when he started explaining this thing. And I also told him, you know what, we also have some legislation that is governing that, but anything that is going to make us to be able to give information to people, that will be very, very, then they say, okay, then that's how we started. It was just people having a desire, a common desire to achieve something. And then when it came, it was very, very, it was just something that just came up and then we just click on. And I think that proactiveness, and I also work in that line. I don't want things to be, I just want to, particularly if you know that what we are doing is right, I think I don't want much of them to be having a lot of waste. So I think if somebody's in Malawi, I will suggest how, based on the experience I have with doctor, I think that could be a good start, and then maybe work with them and then see how they can learn and they actually share those experience they have with us to call it in Malawi. I know the Malawi. I don't know who is responsible for air quality. Whether it's the Malawi, they have what you call environment directorate or whatever on a particular ministry. But I don't know who is. But at least I know some officials there in Malawi, and I have no problem if they need more. I can actually talk to them based on the experience I have. But I also suggest that the experience I have with Permian Health Institute could be very much useful if they want to start from somewhere. And then they can also leverage from the experience they have with Permian Health with Gambia to be able to sell those kind of things at that level. But the management in terms of environmental protection in the Department of Environment, I think I was there some time back, but a little bit some years ago in Malawi. But I know a lot of them because we meet at international level. Most of the people at that place, the environment thing, I know them. So I would suggest that at least for a start, and then trying to know the experience that has, I will suggest at least they can engage Permian Health Institute and see how they can take it up from there. And for us also, if they need other experience, how did we really influence our politicians, policy makers? That's what we can do. But the basic thing first has to be intact. First, you have to get the information, you have to get the data, and it becomes very easy for you to be able to talk to people when they see when they realize that this is what is happening. But if you want to go on and talk on an abstract level, it doesn't going to help a lot because they want to see, but what are you saying? What can you show to say that this is what is happening in the country? So these are things that that can be done. But our based on the experience, we can also share with them on what we have learned, some of the challenges we have faced, and how can we address those kind of things, or how did we address them as we move along? Yes.
Thank you. And yeah, I think not only thank you for the advice, but even the offer of connection is fantastic. And I'll take this question to Dr. Touray. I suppose the same question of how any advice you might have for Collins, who's trying to engage with the Malawi government, and maybe also in our last minute here, just also offer you the opportunity to broaden that out to any other advice you might have for an initiative similar to Permian Health that's organically developing elsewhere across the world, and any advice you might have in their journey that from your experience.
I think the first thing would be to identify the stakeholders in the country that you're working in. Identifying who is the legally mandated authority for air quality legislation in that country. Partner with them and partner with them very early. Involve them in the conception phase. What we did in Gambia was that we did the first clean air conference, and at that conference was the NEA, the Ministry of Health, basically anybody that I thought would have an interest in, air quality monitoring, to ensure that we build a coalition of, actors localized to that jurisdiction. And then you can come up with a mutually agreed on plan that, okay, we're going to scale our monitoring. And the idea of this would be that we will be using this data to inform policy. I think it's important to recognize the role of low-cost sensors in geospatial assessments. but also recognize their limitations in terms of their sensitivity, their accuracy for policy making. So a hybrid platform is by default the architecture that you would need if you're going to be intending to influence policy. So we were very clear-eyed from day one that we were going to get a reference monitor. We made sure we got the monitor, but then also we use a low-cost sensor. Low-cost sensor are much cheaper. They call them low-cost, but it's a misnomer, quite frankly, because the cost of purchasing them is just one part of it. There's a maintenance cost involved. But they're easier to install. They're, much more nimble in terms of where you can put them. But while you're doing that, intentionally pursue reference monitoring with the intention that that data is going to be used by the regulatory authorities to make decisions. They're not going to rely on sensor data for that information. And so also the private sector, we partnered with real estate agencies at Taft City. We partnered with the TV stations. Because for me, that's what I'm most excited about, because when QTV starts talking about the weather and air pollution, that is massive public health, environmental health literacy elevation at scale. And they've embraced this on their own accord. And I want to shout out IQ Air because their platform, the APIs are very easy to use. And it's going to be in local news. So when we have that Hamilton dust storms, they're going to start giving people warnings. And actually, the Ministry of Health for the first time issued health advisories based on the data that we have. And I think how we streamline that process is that issuing health alerts, in a more consistent, more formalized way would evolve over time. So again, Ministry of Health, Ministry of Environment, Transport, Energy, Urban Planning. We're going to be sharing our data in Gunjur to the Ministry of Urban Planning to demonstrate to them that, look, how we build our urban spaces has an impact on air quality at a very local level. And so that is how I would go about doing this. And getting the government agencies involved at the onset is going to make it a lot easier, because I would not have had permission as a private organization to put sensors at the airport, at the seaport. I mean, they're going to, that's just illegal, right? So, but with NEA, as our partners, it was a no-go, just a formal request, and we were able to install them in these areas. So that's going to be the main advice that I would give to anyone who wants to do this at scale in those countries.
I think we just got a master class in this last hour for groups across the world on how to really effectively engage in partnership as a civil society actor and a government actor. And I wish we had another hour to talk about this. I know we would fill it up just based on the questions and the questions I still am curious about. But thank you both so much for joining. Really, really appreciate your time and sharing your brain power to this larger effort. And thank you everyone else who has joined in the audience. I know we didn't get to all the questions. I will share a connection between folks afterwards for some of those questions and appreciate them. But anyway, as many of you know, and as Dr. Badgie mentioned, we're hosting this conversation in the run-up to the UN's International Day of Clean Air for Blue Skies this weekend on Sunday. We hope that day and this conversation you just heard will be a timely reminder that while air pollution is the world's greatest external risk to human health, countries, and most especially the people working within them, are showing that progress is possible. And you just heard a great example of that here in the Gambia. So please join us for our next conversation later this month, and also another one in October, in which we'll explore policy work in Thailand and Pakistan. I hope everyone has a great weekend ahead, and happy Clean Air for Blue Skies Day. Bye, and thank you.
Yeah, thank you, everyone. It's an honor.